It is a relatively rare disease. However, it is an incredibly debilitating disease. It commonly gets mistaken for MS because a lot of the symptoms can be the same. However, patients get much more severe disability. One of the most common is visual loss, which tends not to improve over time. So people can have near blindness or even total blindness in one eye or both eyes. It can also affect the spinal cord. So people have very severe walking difficulties. And sometimes become wheelchair bound or need a cane or a walker. And again, it tends not to recover very well. There's also another part of the brain that can affect vision. It can affect swallowing. So it can affect very critical parts of the brain and cause marked disability in a very short period of time, unlike MS. So most of the patients I saw were very, very bad, and they didn't respond to our normal MS medications, as well as being misdiagnosed too, a lot of times as well. So it became a longer time before they could receive any kind of diagnosis. So initially, the MRIs look somewhat different than MS. The other big breakthrough is when they developed the blood test for an anti-aquaporin 4 antibody. So they actually isolated one of the key drivers that was causing this disease. Still, there's about 33% of patients that are aquaporin antibody negative. So we're not entirely certain why that is, but they tend to get less severe disease than the ones that are positive. So it's a combination of clinical as well as the MRI and also the antibody test that helps with the diagnosis. So up to very recently, there were no approved drugs for this. So people used a whole wide variety, but we really didn't have any good data up to this point. So there was a multitude of different drugs, some used for other immunological disease, such as rheumatology, and some had also been used for multiple sclerosis as well, too. Again, the problem became is we had no good controlled trials to see whether these drugs were truly effective longer term for these patients.